Hi everyone, and welcome to this lecture where we're going to be talking about the abdomen, the neck, and the back. And so first, when we're actually starting to talk about this, we'll start with the muscles of the thoracic wall. And these are muscles that are attached to and or cover the thoracic cage. So for example, when we think about the axio-appendicular muscles that extend from the thoracic cage of the axial skeleton, we're talking about the ones that also go from that thoracic cage, the axial skeleton, to bones of the upper limb, which of course is the appendicular skeleton. Similarly, some of the muscles of the anterolateral abdominal wall, back and neck, have attachments on the thoracic cage itself, which we can actually see here. We have the pectoralis minor going from the ribs up to the coracoid process, for example. We've got the subclavicular or the subclavius that attaches there. And so the axio-appendicular muscles act primarily on the upper limbs, but several of them, including the pectoralis major, the pectoralis minor, as well as the inferior part of the serratus anterior, also function as accessory muscles that help us with respiration, because they actually help elevate the ribs to extend the thoracic cavity when we're doing those deep and forceful inspirations, for example, when sprinting. In addition to that, our scaling muscles, which you can see here, there are 3 of them, those actually descend from the vertebra of the neck to the first and the second ribs and act primarily on the vertebral column. But those scalenes also have another function as accessory respiratory muscles by fixing these ribs and enabling the muscles connecting the ribs below to be more effective in elevating the lower ribs during forced inspiration. Now, the true muscles of the thoracic wall are the serratus posterior, the levatus costarium, the intercostal, the subcostal, and the transversus thoracis. And as you can see here, they're all in this picture, okay? And so, or some of them you can't actually see in this picture, they're on the other side. So if we think about them from this view, we can actually see the origins and insertions of these muscles of the thoracic wall. We have the serratus posterior here, which is traditionally being described as inspiratory muscles, but in spite of this common thought that that's what they do, there's no evidence from electromyography to actually support this. On the basis of its attachments as well as its disposition, the serratus posterior superior is actually said to elevate the superior foreribs. They're actually attaching underneath the scapula here. So they're underneath, they're on the ribs, and they're supposed to elevate those superior ribs and increase the diameter of the thorax by raising the sternum. Whereas the serratus posterior inferior, which is all the way down here, okay, those are said to depress the inferior ribs, preventing them from being pulled superiorly upwards by the diaphragm. Okay. But more recent evidence using more technological advances have shown that those serratus posterior muscles may not have a primary motor function. In fact, those muscles, especially the serratus posterior superior, may actually be implicated as a source of chronic pain in myofascial pain syndromes, and so therefore having a proprioceptive rather than a motor function. The next muscle, the levatoris costarium muscles, which derives its term from Latin levator or lifter, they're actually a set of 12 fan-shaped muscles that elevate the ribs. Okay, and in their role, if any, is in normal inspiration is really uncertain. And so they're actually thought also to play a role in vertebral movement as well as proprioception. Important for us is the intercostal muscles that occupy the intercostal spaces. You can see them here. Here's the intercostal from the lateral view and also from the anterior view. So the external intercostal muscles, of which there are 11 pairs, occupy the intercostal spaces from the tubercles of the ribs posteriorly all the way to the costochondrial junctions anteriorly. So they're really broad in their aspects there. So anteriorly, the muscle fibers are replaced by the external intercostal membranes, but these muscles run infero-anteriorly from the rib above to the rib below them. And so this is when you eat that lovely plate of ribs, this is what you're eating, okay? These muscles run continuously inferiorly from the external oblique muscles in the anterolateral abdominal wall, and the external intercostals are most active during inspiration. In contrast, when we see the internal intercostal muscles, as shown here on the lateral view, as well as here on the anterior view, we also have 11 pair of these, and they run deep and at right angles to the external intercostals, so they're much deeper, okay? Their fibers run infero-posteriorly from the floors of the costal grooves to the superior borders of the ribs that are inferior to them. So again, they're actually, this is why there's 11 pairs, they're in between our ribs, okay? The inferior internal intercostal muscles are continuous with the internal oblique muscles that are in the anterolateral abdominal wall, and the internal intercostal muscles are most active during expiration, right, when we're actually breathing outwards. So here is actually a table for you showing you those muscles of the thoracic wall, the serratus posterior all the way down to the intercostals, etc., and to kind of show you where they start and where they end, and understanding that their main action, because they're attached to our rib, but also to the appendicular skeleton, they do have a minor role in movement, but their primary role is either in proprioception or when we're actually elevating the ribs or moving that rib cage during breathing. Now, if we move to the muscles of the abdominal wall here, there are actually 5 of them, and they're arranged bilaterally paired in the anterior lateral part of the abdominal wall. So you've got 3 flat muscles, which are our external oblique, our internal oblique, as well as the transverse abdominis. In addition to that, we actually have 2 vertical muscles, our rectus abdominis, as well as the pyramidalis, okay? And so, if you can look at this picture here, I know there's a lot going on it, but it's really important that you be able to find all of these muscles as you're actually going through it, okay? And so, first what you should be doing is actually looking to find the external oblique, which is up here in subset A. Look at its attachment here, right on the crest of the ilium. And you can actually see them attaching in the midpoint of our lower ribs. In contrast, if you look at the internal oblique, where do you think that is? It kind of gives you a hint if you think about its name, and that of course is indeed, it's actually a bit more inwards, or lies deeper than our external oblique. Okay, and we can see this here in layer B. So this is again if we remove the external obliques here. And if we go even deeper into layer 3, we see the transverse abdominis, and by its name it should actually give you a hint as to what its function is, right? Because by virtue of its name, it actually moves in the transverse direction, and using the term abdominis, it can really tell us what it does, right? And that is in fact going from our rectus abdominis backwards and making its attachments there. And so in the 2 vertical muscles, the rectus abdominis, okay, move of course in their vertical direction, and you can see the rectus abdominis in this figure D here. You can see it lines up nicely going from the costal cartilages all the way down into the pubic crest. Yeah? And in contrast, we actually have the pyramidalis, which is a lot harder to find and to actually access. It's not shown in this image. But those are the muscles that we have in the anterolateral abdominal wall. So here is the slide showing you the table of those muscles that we're talking about, their origin, insertion, as well as their main action. And what you can see here is that they do have some role in compressing and supporting the abdominal viscera that are behind it, and that's one of the functions of the anterior lateral abdominal muscles. But another part of them is, of course, to move the trunk and help maintain our posture, okay, as well as they actually help form a strong expandable support for the anterior lateral abdominal wall. So the oblique and transverse muscles act together bilaterally, and they form a muscular girdle that exerts firm pressure on the abdominal viscera. And so this is exactly why your doctor may actually palpate through the anterior lateral abdominal wall, because they're trying to get to the viscera underneath, okay? Now, the abdominal muscles, especially the anterior lateral ones, are involved in movements of the trunk at the lumbar vertebrae and in controlling the tilt of the pelvis when you're standing in order to maintain your posture and also to resist that lumbar lordosis. So strengthening the anterior lateral abdominal wall musculature actually helps improve your standing and sitting posture, and of course making sure that we're placing, when we're sitting for example, making sure that we're not placing or exerting too much force on one part of the intervertebral disc, which could lead to a herniation, for example. The rectus abdominis is an extremely powerful flexor of the thoracic as well as the lumbar regions of the vertebral column, and it actually pulls the anterior costal margin and the pubic crest towards one another. In contrast, the oblique abdominal muscles actually assist in movements of the trunk, especially with respect to lateral flexion and rotation of the lumbar and lower thoracic vertebral columns. In contrast, when we're talking about the effect on the vertebral column, the transverse abdominis doesn't really give us much, okay? So here's just another picture of the anterior lateral abdominal wall that I think is quite nice to show you, just to kind of give you this aspect of it when we're looking from the anterior view. So we get this really nice picture here of our, do you know what muscle it is? The rectus abdominis, that's right. And so this is where we kind of get, if you're that good and you have less fat, I've never seen them personally in my own life, on my own body, but this is how you can actually get that quote-unquote the six-pack, because you actually see that the rectus abdominis actually is bifurcated by these tendinous insertions, okay? What you can also see here is that if we look at this picture here, you can see the contralateral external oblique muscles and their arrangement coming off those lower ribs and moving in towards the fibers of the oblique aponeurosis. So if we look at this picture here of the anterior view, we get to see some really lovely stuff. First, we can see the rectus abdominis on this side, but what you can see if we took that away, you actually get to see the anterior layer of the rectus sheath that lies above it. We can see the linea alba that splits the left and the right side from one another, and as well as we can actually see the external oblique lying just, of course, laterally to the rectus abdominis. And so those are the muscles of the anterior lateral abdominal wall. In contrast to that, and what we don't often think about, are the muscles of the posterior abdominal wall, which of course are our psoas major, which passes inferior laterally. There's the iliacus, which lies along the lateral sides of the inferior part of the psoas major, and we have the quadratus lumborum, which lies adjacent to the transverse processes of the lumbar vertebrae and lateral to the superior parts of the psoas major. Okay? And I know we've talked about these ones before, especially with respect to the fact that they have a role to play in hip flexion. Okay? But these are also considered to be posterior abdominal wall muscles. Just cover them a bit more in depth for you. The first one, the psoas major that we sit here, we can see it here, it's nice and long and attaches down here on the lesser trochanter of the femur. This very thick fusiform psoas major lies lateral to the lumbar vertebra, and it gets its name psoas from the Greek word meaning muscle of the loin. And so the psoas muscle of animals is actually called the tenderloin, not to be confused with that dirty, disgusting place in downtown San Francisco. So the psoas major passes inferior laterally, as you can see here, it goes down and outwards, deep to the linguinal ligament to reach the lesser trochanter of the femur. Okay? The iliacus, on the other hand, which you see here, is a large triangular muscle that lies along the lateral side of the inferior part of the psoas major. Most of its fibers join the tendon of the psoas as it moves downwards here, and together the psoas and the iliacus form what's known as the iliolus, which is the chief flexor of the thigh. But in addition to its role here as a chief flexor, it also serves to stabilize the hip joint, and it helps maintain the erect posture of this joint. Okay? So while together the psoas and the iliacus share in hip flexion, only the psoas can actually produce that flexion or lateral bending movement of the lumbar vertebral column because of its line of pull and its attachments on the vertebra itself. The third muscle of the posterior abdominal wall is the quadratus lumborum, and of course by now you've heard enough terms called quadratus that you should know that it is quadratic in its shape. This quadrangular muscle forms a thick muscular sheath in the posterior abdominal wall that you can see right here. It lies adjacent to the lumbar transverse processes right here that we see here sticking out, and it's broader inferiorly than it is superiorly. Close to the 12th rib down here, the lateral arcuate ligament crosses the quadratus lumborum as it's moving inwards. But that's something that you can really get into if you decide that you want to go to medical school or physical therapy school or nursing. Okay? So here is again just one of our slides kind of recapitulating the three muscles of the posterior abdominal wall, as well as what they're actually there for, where their attachments are, both with respect to the origin and the insertion, as well as what their main actions are. This is primarily here just to help you as you move forward in your career so that you've got something that you can refer to. Okay? Now, this is a muscle that everyone loves to talk about, the sternocleidomastoid, otherwise called the CSM. Now, the sternocleidomastoid muscle is a key muscular landmark in the neck, and it forms the sternocleidomastoid region. So what I want you to look at while you're actually on this slide is both, of course, its origin and its insertions, but in order to do that, I want you to think about what it actually divides. And as you can see in this picture here, the sternocleidomastoid muscle visibly divides each side of the neck into the anterior and lateral cervical regions, or what we call the anterior and posterior triangles. Okay? And so when we're looking at this part here, we can see some of the aspects. In part A here, this is called the sternocleidomastoid region, which you can see both in this figure here, as well as in down here you can see your sternocleidomastoid. It's a nice thick muscle. So in each of these pictures, it's denoted by the letter A. In contrast to that, as we actually move onwards from this, we also notice that the sternocleidomastoid, which is a broad strap-like muscle, it actually has two heads. It has a rounded tendon that attaches on the sternal head of the manubrium, and that it also has a thick, fleshy clavicular head, which attaches to the superior surface of the medial third of the clavicle down here. So here's its nice fleshy attachment on the sternal head and down here on the medial third of the clavicle. So it's really easy to palpate in case you get some trigger knots there. So the two heads of the sternocleidomastoid are actually separated inferiorly by a space which is visible superficially as a small triangular depression. Okay, and in fact, due to this is what they call the lesser supraclavicular fossa, and of course now you know what a fossa is, yeah? And so this lesser supraclavicular fossa is denoted by this number A, which you can see here, by the number 1, which is down here, and you will also actually be able to see it if you palpate on the musculature itself. So the sternocleidomastoid, if we go into this part here, we can actually, not a good view, we'll come back, but it actually produces movement at the craniovertebral joints, the cervical intervertebral joints, or at both of them. The cranial attachments of the sternocleidomastoid actually lie posterior to the axis as well as the atlanto-occipital joints. And starting from the anatomical position, if you tonically contract the sternocleidomastoid, you can actually maintain the posture of the cervical vertebral column. And what happens is if you contract both of the sternocleidomastoids, of course they're bilateral, so on both sides, you can actually cause extension of the head at the atlanto-occipital joints and elevate the chin. Oh, sorry, I skipped ahead too much. So what you can see here in this lovely picture is if you actually contract one of your sternocleidomastoids, so by itself, what you get is you get this lateral flexion with rotation. If we actually contract them bilaterally, we get extension at the atlanto-occipital joints. And we can actually, if you're in the supine fashion, by flexing the sternocleidomastoid, we end up with flexion of the cervical vertebra. But that only occurs if you are actually lying down, okay? So again, the sternocleidomastoids can act bilaterally or they can act unilaterally. And so just understand that where those origins and insertions are, and it'll kind of really give you a good guide as to what the sternocleidomastoid muscle is helping with. So, in addition to the sternocleidomastoid, we have the platysmus and the trapezius. Now, you know all about the trapezius, I think. That's quite clear. And the platysmus is best shown if I go back to this page here. Look at it. It's a really lovely, thick, flat kind of muscle. Okay, and it gets its name, guess what, from? From the platypus, which also has that kind of flat-looking tail. Now, the main action of the platysma is to draw the corners of the mouth inferiorly and widens as if we're making those sadness or frightful expression. And in addition to this, it draws the skin of the neck superiorly when you're clenching your teeth. So clench your teeth, and then you can actually feel the platysmus muscle, okay, actually contracting. Okay, it's not one I know that we typically think about in kinesiology, but it's quite important when we're making those head movements, perhaps to try to find a ball, or as we're trying to catch a ball if we were doing baseball. If we come down to the muscles of the surface anatomy of the neck, we can actually kind of figure out what we can actually see with respect to these muscles that I've just talked about. So one thing that you should kind of understand is that we can actually really visibly see the platysma there, and you can see that in figure A. We've got the platysma actually really showing up for us right here. Okay, both in this direction and also inwards. Of course, we can actually visibly observe as well as palpate the sternocleidomastoid, shown here in number A. Okay, the sternocleidomastoid for me is right here, and I can, in addition to this, I can see the sternal head coming downwards here. Yeah. The scalenes you can see, but we'll talk about those in a little bit. But those are the muscles that you can really palpate and see. If we move on to the deep neck muscles, everyone's favorite, we can actually see that these consist of both anterior vertebral muscles as well as lateral vertebral muscles. The anterior vertebral muscles that we want to talk about are the longus colli and the capitis, the rectus, keep hitting the wrong button, the rectus capitis, and the anterior scalene muscles, which are my favorite muscles ever. Okay, so the longus capitis actually goes from the anterior tubercle of C1, which you can see up here. Here's the longus. You can't see the longus colli from this view. Here it is, here, down here. So it's actually attaching from the C1 vertebra and actually goes down to the C5 through the T3 vertebrae. And its main action is to flex the neck with rotation, kind of like in a torsional movement, and to the opposite side if acting unilaterally. We have the longus capitis, which is right here, which goes from the basilar part of the occipital bone on the back of the head and makes its way down to the anterior rami on the C3, C6 transverse processes of those vertebrae. And this, of course, flexes the head. We also have the rectus capitis anterior, and that should kind of give you a hint to where it is. So it's right here. It's a very small muscle. It starts at the base of the cranium, and then it actually goes all the way down to the anterior surface of the lateral mass of the C1 vertebra. Also serves to flex the head. And we have the anterior scaling, which actually comes from, you can't quite see its origin, from the transverse processes of C3 through C6 vertebra, and makes its way down to the first rib. And all of those muscles are there to actually flex the head, okay? In addition, we have the lateral vertebral muscles, which consists of the rectus capitis lateralis. You can see the rectus capitis lateralis right here in the top of this picture. And that goes from the jugular process of the occipital bone down to the C1 vertebra, and it serves to flex the head and help stabilize it, right? Nobody wants a floppy head. In addition to that, we have the splenius capitis, which goes from the inferior part of the nocal ligament up here, close to the ear. You can also see it on this view here. Okay. Oh, sorry, the splenius capitis, pointed to the wrong one. You can only see it on this view. And that goes down to the superior part of the medial border of the scapula, and that is there for downward rotation of the scapula and also tilting of the glenoid cavity. And we also have the other two parts of the scaling, the middle scaling as well as the posterior scaling, and both of these actually go from the posterior tubercles of the transverse processes of the C5 through the C7 vertebra, and they actually come down and border on the first and second rib respectively. And the role of the middle and the posterior scaling is actually to flex the neck laterally, as well as to elevate the second rib during forced inspiration. Okay? And so, those muscles of the neck are very important for moving the head, and I know we don't think about them again, but they're really there to actually help us with the flexion of the neck. In contrast, when we think about the muscles of the back, what we're really thinking about is understanding that those muscles actually, most of our body weight lies anteriorly to that perspective, especially in obese people. And consequently, the many strong muscles that are attached to the spinous and transverse processes of the vertebra are actually quite necessary because they help us support and move the column. There are two major muscles in the back. There's the extrinsic back muscles, which include both the superficial as well as the intermediate muscles that produce and control the limb and respiratory movements respectively. But we also have the intrinsic or the deep back muscles, which include the muscles that are there to produce movements and to maintain our posture. If we think about the muscles of the back, we'll go through them both first at the extrinsic back muscles, and then we'll talk about the deeper intrinsic muscles. So what are our extrinsic back muscles? Well, the first of them that we should know about, the superficial external ones, are our trapezius, our latissimus dorsi, the levator scapula, and the rhomboids, which we've already talked about way back when we first started our discussions about anatomical kinesiology. And these superficial extrinsic back muscles are posterior axoappendicular muscles that produce and control our limb movements. In contrast, our intermediate external extrinsic back muscles are, for example, our serratus posterior all the way down here, And these are commonly designated as superficial respiratory muscles, but are more likely proprioceptive than motor in function. Our intrinsic muscles, on the other hand, are the ones that are very, very deep, and they serve to maintain posture and control movements of the vertebral column. And these are actually grouped into superficial, intermediate, and deep layers according to their relationship to the surface of our skin. The ones that are most superficial in nature are our splenius muscles, and these are thick and flat muscles, and you can see here that they actually start where the neutral ligament is and on the spinous processes of also C7 through the T6 vertebrae, and their distal attachment, they run superior laterally to the mastoid bone of the temporal bone, the mastoid process of the temporal bone, as well as the lateral third of the superior nuchal line of the occipital bone. And if you think about where this is located on the posterior part here, it's when they act alone, i.e. just on one side, they serve to laterally flex the neck and rotate the head to the side of the active muscles. And when they act together, they extend the head and the neck. If we go down, okay, so the intrinsic back muscles and especially the immediate layer, we're talking about those massive erectus spinae muscles that lie within the groove on each side of the vertebral column, and especially with respect to the spinous processes and the angles of the ribs. So the erectus spinae muscles, and this is of course a group of muscles, these are actually divided into three columns. There's the elecostus, which forms the lateral column, okay, which you can see here. There's the I can never say this one, longissimus, which is the intermediate ones here. And then there's the spinalis, which, as the name suggests, forms the medial column, okay? And in this intermediate layer, what you'll notice about them, these long muscles of the back, as the name suggests, are there to actually make the spine erect, okay? These are dynamic muscles, and their main actions, especially when acting bilaterally on both sides of the spine, are there to extend the vertebral column in the head. So as you flex your back, this control movement is there using eccentric contractions. And when the erectus spinae muscles on just one side of the spine act, so they're acting unilaterally, they actually serve to laterally flex the vertebral column in either towards the left or the right. Now, if we go one layer deeper on the back, we can actually see that deep to the erectus spinae muscles is a group of short muscles which are called the transversospinalis muscle, and this consists of three separate muscles: the semispinalis, the semifidus, and the rotatoris. The semispinalis muscle is a superficial member of the group. In contrast, the multifidus, which you can actually see right here, is the middle layer of the group, and it consists of these short rectangular muscle bundles, that are thickest down here in the lumbar region. And if we talk about the rotators, or the rotator muscles, these are the deepest of the three. Look at them, they're tiny, they're very tiny. And these here are best developed in the thoracic region, and they make their connections, as you can see, very, very close to the posterior part of the vertebra. So these three intrinsic deep back muscles are very minor deep back muscles that are sparse in the thoracic column, right? Moving outwards, moving laterally to medially. Here's a wonderful, just a summary slide on these intrinsic back muscles, especially those transversospinalis muscles that we talked about. And we don't really need to spend much time about the deep layer, but what you need to understand is that they're really there for extension movements, and they can serve to work unilaterally, but that's what will get us that lateral flexion. So when we talk about the muscles producing cervical movement, you can notice that the scalenes, The longus colli and the sternocleidomastoid muscles are there to produce flexion. The ones that produce lateral flexion to either side, of course, are our scalenes as well as our intertransversi. And the muscles producing extension here can be our sternocleidomastoid muscles. With respect to thoracic and lumbar movement, when we're talking about flexion from the started extended position, we have both the psoas major and the rectus abdominis that are stretching, right? And as we're moving into flexion, we get a stretching of the erectus spinae as well as those deeper muscles. And this is just a view down here to show you the type of movements that you have there. We've talked about the surface anatomy of the back muscles, so I'm not going to tell you what should be palpable. This should be well known by now. And you should, of course, note that you cannot palpate your deep posterior back muscles. It is impossible. I'm going to negate the slide on the suboccipital and deep neck muscles. It's a bit too in-depth, but you'll get to see that if you go into med school. I just want to finish off with this last slide on the muscles producing movement at the atlanto-occipital joint. Most commonly here is when we're talking, we can split them into flexion and extension. In this case, you'll see those muscles contracting in a bilateral fashion. But if they act unilaterally, so on just one side of the body, you're actually going to get lateral flexion, so moving to either the left or the right side. And just to finish off is this horrendous slide showing you the muscles that produce movement at the atlanto-occipital joints. And I'm not going to make you responsible for this. I just thought I'd end this very last slide in the class on the most horrendous slide possible. Ha ha ha. Okay, thanks for listening. It's been a joy. I'm off to go and relax and have a wine or four. Ciao for now. If you have any questions, be sure to let me know. Bye-bye.